Okay. It should be recording now.
Great. Welcome, Dr. Ettensohn. I'm very happy to have you here. For the people who are watching us today, I'd like to introduce us. I'm Lisa Taylor Austin, a licensed psychotherapist and expert witness. And today I have as a special guest, Dr. Mark Ettensohn, who is a clinical psychologist working in private practice, seeing patients with narcissistic personality disorder. He's also the author of a book, Unmasking Narcissism, A Guide to Understanding the Narcissist in Your Life, which is over his shoulder on the bookcase. It's the yellow cover. There you have it. And he has a very successful YouTube and podcast channel called HealNPD. Thanks for coming here today. I really appreciate it. I think your insights are going to be very valuable because there's so much misinformation about NPD. And I hear, many people confusing different diagnoses together. And so I think you're going to be able to shed some great light for us. So I appreciate that. Tell us a little bit about.
Happy to be here, by the way. Thanks for
Oh,
having me.
thanks. Yeah. Tell us a little bit about what drew you to want to work with narcissistic personality disorder clients.
Yeah, well, I get that question a lot, actually. And I'm just going to adjust my chair here 1 second. Sorry about that. Okay.
Mm-hmm.
I get that question a lot. So when I was in graduate training, my first psychotherapy patient I ever had, it was a really difficult case and I couldn't figure out what was going on. I felt like I was of no use to this patient a lot of the time. But at the same time, he kept coming back and seemed invested in the therapy, but I couldn't fathom why that could possibly be. And so I found myself talking about this patient a lot in supervision. And I ended up, spending a lot of time in the library, just trying to kind of wrap my head around what these dynamics in session that I was experiencing were. And I, lucked out. I came across some really quality literature about narcissistic personality styles and narcissistic personality disorder very early on. And I ended up, out of necessity, doing my master's level clinical competency exam, where you have to like present a case and do a write-up and stuff for a panel. I ended up doing it on that patient because he was my longest running patient at that point. And so as I wrote up a case formulation and stuff like that. And in the course of doing that, I think I kind of discovered that kind of vulnerable underbelly of narcissism, and the sort of tragedy of the disorder really spoke to me. I've always considered myself to be a humanist, and I was my application essay to graduate school, featured a long quote from Carl Rogers that I've actually used in one of my videos, just talking about the kind of inherent growth potential in people, the kind of, he calls it the self-actualizing tendency of people. And I guess that's always been a central facet of my interest in doing psychology. And I guess for whatever reason, I just really kind of zeroed in on how that can get complicated, turned on itself, et cetera, in personality disorders, but in NPD in particular. And then later on, when I was doing my dissertation, I needed a topic, and I'd already learned so much about NPD, and I decided to look at NPD through the lens of attachment theory for my dissertation, and that just kind of set everything in motion and turned into the book that you referenced, that the research I did for the dissertation. And eventually I realized that I know a lot about this, and the population, I feel a lot of empathy for that population, and and I decided to specialize in it. So,
Good for you. I love that story because you're really describing how your client was your best teacher.
yeah, yeah. I mean, I didn't particularly like working with that client all the time because he made, like I said, he made me feel useless. But at the same time, I came to understand how that feeling I was having was about his own, you know, defensive adaptations that he'd been forced to make in his development, um, and um, and also that it was telling me something about how he felt on the inside. And so that those dynamics just were fascinating to me.
Yeah, that's great. It's really good that you decided to go in that direction because there's so many therapists who A, don't know anything about narcissistic personality disorder
Yeah.
through no fault of their own. And we'll get to that in a little bit. But it's great because I don't think there's a lot of therapists out there working with people with NPD. Um, we often hear that people with NPD do not seek therapy and that they're usually forced to go by a significant other as like this last resort, go to therapy or else type of thing. Some people obviously are also ordered by the court. I'm curious to know how most of your clients come to you.
That's a great question too. Um, so now that I kind of have this online presence,
Mhm,
I get found pretty
mhm,
easily. I think you're right. I think the majority of people who have a narcissistic personality disorder, um, most of the time they're not interested in seeking psychotherapy, right? Because that's going to make them vulnerable. They would have to admit that
mhm,
there's something, they need help with something, you know.
mhm,
And of course they run the risk of shameful exposure, right? In the
mhm,
course of doing that. But the thing is, you know, a lot of times, well, not a lot of times, but sometimes folks with NPD, their grandiose defenses will collapse,
yes.
and they kind of have a crisis, and they'll often seek psychotherapy in the midst of that crisis. And I think that's when a lot of therapists see narcissistic patients in their practice. They may or
Mhm,
may not recognize it to be NPD, and that has to do with
mhm,
the diagnostic criteria that focus on grandiosity. But they nevertheless, right? The person will often present, um, feeling depressed, having considerable anxiety, feeling lost, feeling like they don't, you know, um, like they've kind of their relationships are falling apart, that sort of thing.
mhm,
Um, and they'll stay in therapy long enough to kind of weather that crisis, and their until the kind of grandiose defenses are kind of reconstituted, and then typically will leave therapy, right? And
mhm,
that's kind of like there's kind of a revolving door dynamic that can happen there.
mhm, mhm,
You know, I think um, what happened for me is that the more interested I became in this topic and the more of my kind of career I started to devote to it, and especially after I published the book, I just kind of got known in my referral networks for working with narcissistic patients. So I would get referrals that way. And oftentimes it would be patients who didn't seek therapy, ostensibly because they're narcissistic, but the analyst or the therapist recognized that there are narcissistic dynamics here and then referred them to me. And so
very
that's
good.
that's kind of how my practice got started that way.
Mhm.
Yeah.
Thanks for that.
Yeah.
Yeah, that's interesting. Because I think a lot don't seek therapy for the reason you state. However, I've noticed that the people that I've talked to with narcissistic personality disorder, they might not know that that's the condition or the personality disorder that they have, but they know they're different from other people. Have you found that?
Yeah, I think so. And again, a lot depends on the individual, right?
Hmm.
But I've often heard from people that there's an experience of kind of being outside sort of
Mm-hmm.
the human experience in some essential way.
Mm-hmm.
One patient described it as kind of being like, imagine like a cold winter's night, right? And kind of wandering the snowy streets and then looking into a window, and there's like a warm living room, a
Mm.
fire is burning, and the family's there, and they're all kind of experiencing that closeness and that togetherness, and the person just feels like um, kind of permanently separated from that somehow.
Mm.
And that
Mm-hmm.
alienation can be really painful, if a person allows themselves to feel that. And that doesn't always happen, of course, because of the nature of the false self and the grandiose defenses that happen in NPD. A lot of times there can be this compensatory fantasy of self-sufficiency, right? I don't need
Mm-hmm.
anybody. I'm great. They all suck. I'm amazing. And
Right.
that works for as long as it works. It works until it doesn't, until they encounter some situation in their life that is not solvable via that fantasy of self-sufficiency, and then there's the collapse that happens. And for
Yeah.
some people that happens on a daily basis, and for some people that happens once in a blue moon.
That's a good point too, because do you find that covert or vulnerable narcissists, I should say, actually experience that more frequently? Or do
Yeah.
you find,
Well, so all narcissists are grandiose and vulnerable, right? So
mm-hmm, mm-hmm,
there's a combination of grandiosity and vulnerability, and it
mm-hmm,
depends on where the sort of flaws in the armor are, so to speak.
mm-hmm,
Um, some folks who I think we might call vulnerable narcissists, we would call them that because of the propensity for those grandiose defenses to break down more often, or
mm-hmm,
in more areas of life.
mm-hmm,
And so, yeah, when and frankly, most of the people that I work with, I would
mm-hmm,
probably put in that category because those are the
mm-hmm.
people who are seeking help, right? Um, when somebody's just really well defended, they're not feeling the need for help, so they don't
Mm-hmm.
seek therapy, right? I mean, maybe a spouse or a family member or something pushes them into therapy. And when that happens, we see how much uh, uh, of a alliance, we can sort of build. But if a person is defensively minimizing their need for treatment, then there's not much I can do about that. I'm certainly not going to, argue with a patient about their need for treatment, right? I just kind
Right,
of reflect back what I see, and they either agree with it or they don't. And if now's not the time, then maybe they'll come back later.
in the future. Yeah. Um, as you know, on social media, as you've experienced it, there's so much false information, stigmatism, uh, demonizing, really, of this
Yeah.
personality disorder. And I find that, I think, to be from the fact that people who experience, they're on the receiving end of someone with narcissistic personality disorder, feel as though the narcissist is manipulating and doing all these things on purpose.
Mhm.
And I think that there's some confusion between narcissism and antisocial personality disorder. I know that was kind of three questions in one, but what's your response to that?
I agree.
Mhm.
Um, yeah. No, I think there's a lot of confusion, and there's a lot of anger, and there's a lot of pain, you know?
Yeah, yeah.
Um,
And
yeah.
narcissists do not target people. That's antisocial personality disorder, correct?
I mean, generally, I think I would agree with that. I
Hmm.
think, for folks with an antisocial personality disorder or with psychopathy or sociopathy,
Hmm.
um, th- you know, uh, power differentials are really sort of the key thing, right? Having control, having power, dominating, right?
Hmm.
And so that is sort of the main um, what's the word I'm looking for here? Sort of differential, I guess, in their
Hmm.
relationships. And so, whereas in NPD, the issue is self-esteem, right? It's a faulty or fragmenting self-image that's unstable or unrealistic, and the person's attempts to try to prop up that unstable self-image. And oftentimes those attempts to do that are maladaptive, right?
Hmm.
But that's a fundamental difference, right? Sort of seeking power and control versus trying to prop up a self-image that feels like it's falling apart. Um,
Absolutely.
and so, and sometimes those come together, right? I mean, there can certainly be a blend
Hmm.
of those dynamics, and we would call that malignant narcissism. It's a theoretical construct, not really a diagnosable disorder. But, and I've made a video about that on my channel as well, trying to kind of explore,
Hmm.
the theoretical underpinnings of malignant narcissism and what that actually is. But typically, it's a combination of psychopathy, something called egosyntonic sadism, which would be just a way of sort of enjoying or feeling reconstituted by causing pain to other people. So, and that's a projective phenomena, right? Like,
Hmm.
I feel weak on the inside, so instead I make you weak, and in doing so, I experience a feeling of power, and that makes me feel strong, right?
Hmm.
Not me personally, but
Right.
someone, yeah, with that issue. Um, and paranoia as well. So those three things kind of come together with a narcissistic personality core to make malignant narcissism. And that's a whole other thing. That's not just like really bad narcissism. That's a combination of multiple personality issues, including narcissism, right? So I think
Right.
sometimes people use the term malignant narcissism to mean like a really narcissistic narcissist, but a really narcissistic narcissist is somebody whose self-image is falling apart all the
Hmm.
time, and there's a
Hmm.
desperation to try to reconstitute that self-image, and they do so via exploitative interpersonal strategies sometimes, right? So you know that feeling of being used can come from that, because if a starving person, all they want from you is food, right? Uh,
Hmm.
somebody whose self-image is falling apart, all they want from you is narcissistic supply, or the clinical term for that would be a self-object experience, to
Hmm.
try to reconstitute that feeling of self.
Hmm. I really like that explanation. It's clear. And I think that this is a very confusing topic, so I
It is.
appreciate that.
Yeah. um yeah. And and speaking as sort of a YouTube creator, right? And I know obviously you are as well. There's just that this space is saturated by clinicians or coaches or abuse survivors talking about narcissism in one way, shape, or form, and not all of them are getting it right. You know, and so there's a lot of, I think, misinformation out there, and I think there's a lot of reactivity. Um,
Hmm.
so I
Hmm.
have a colleague, when I wrote my book, I had this colleague, and she would read drafts of each chapter and then give me feedback, right? And one of the things she said was, well, this is a disorder that's based on splitting, and so people who are affected by individuals with this disorder are also splitting, right? It's just kind of the nature of splitting, right? Once we start kind of polarizing things into you're good or you're bad, you're worthless or you're superior, whatever. Um, Now, if I'm on the receiving end of that, then I am rallied in defense of my own goodness, right?
Yes.
And so that usually involves saying, no, I'm not bad, you're bad, right? And so
Hmm.
now everybody's splitting, and nobody's seeing the whole person, the whole
Hmm.
narcissist and the whole, victim or loved one or family member. Everybody gets cut up into pieces. And I feel like a lot of the discourse online about this disorder is kind of coming out of that, you know.
I would agree,
Yeah.
very much so. Um, and so, just to educate people watching, what is splitting?
Oh, yeah. So, there are psychological defenses that we all use, right? As we mature and sort of become more integrated as people,
Hmm.
the defenses we rely on become less and less disruptive to our lives, right?
Hmm.
But when we're very little, we rely on, we just have two or three defenses, right? Because we're a baby or a toddler. And those defenses tend to be global. They tend to distort reality. They tend to disrupt the continuity of internal experience. So perceptions get polarized into good and bad categories because the mind isn't mature enough to put them together, right? And so that's splitting is when a perception or a feeling with the self is split into good and bad categories. And uh, when there's a lot of trauma, developmental trauma or relational trauma, the mind doesn't really develop the ability to put those together because the trauma is so disruptive. And so that splitting defense persists into adulthood. Um,
And so we see that in narcissism,
yeah.
but you're saying we also see it in the people on the receiving end of the narcissist.
Yeah, well, that's just what happens, right? We all get when confronted with these sort of boundary blurring, polarizing, reactive defenses in people, we get pulled into that what's called primitive process, but we get pulled into that way of thinking and relating. If somebody comes up to you on the street and they scream in your face, it's going to be really hard for you to hold on to a kind of nuanced, integrated, um, sort of rational response, right? There's going to
Right.
be you're going to be flooded with affect, and when that happens, there's a tendency to revert back to these kind of more rudimentary defenses.
Hmm.
So you're likely to scream
Hmm.
back or run away or whatever it is, right? But you're not thinking in terms of like integrated objects. Your experience in that moment is split into safety, danger, good, bad. You know. Um,
Yep. Thanks for that. So the Diagnostic and Statistical Manual, which is
yeah,
the book that all mental health providers use to diagnose people,
yeah,
seems to have undergone a lot of changes in its revisions over the years in terms of how narcissistic personality disorder is identified.
yeah.
Do you have insight as to why that happened and kind of where it's going now and that type of thing?
Yeah, so that's these are good questions. So, you know, narcissism is originally a psychoanalytic concept, goes all the way back to 1914 and Freud's essay on narcissism. It, he didn't coin the term, but he popularized it,
Hmm.
and so all the writing and thinking about narcissism was psychoanalytic, all the way up until, the late 70s, early 1980s. And so, because of that, the definition of narcissism in the early versions of the DSM was also heavily psychoanalytically informed. Um, in the mid 1980s, the American Psychiatric Association started to become aware that there was this perception that they were, that their diagnostic criteria were heavily, heavily influenced by one theoretical perspective, and they wanted to make it more theoretically neutral, right? Because you had the rise of, the cognitive behavioral approach and other things like that around that time, right? Um, so they revised the criteria for narcissism to take any reference that could be considered psychoanalytic out of it, and that involved things like unconscious feelings or implicit process stuff like that, right? So they made it only about observable traits. And because the traits that are most readily apparent in narcissism are grandiose traits, they essentially collapsed this complicated construct into just one half of it, which is the grandiose presentation, right?
Right. And it's so complex. It's so much more
Yeah.
complex than that.
Yeah. Uh, and that's so, so now whenever somebody like looks up, hey, what's this NPD I keep hearing about? And they look it up, they see arrogant, exploitative, preoccupied with fantasies of perfection, stuff like that. And that's all true, but
Hmm.
it is counterbalanced by profound deficits, in the personality structure that necessitate those grandiose compensations. And you don't read anything about those in the DSM. Now it's changing a little bit. When the DSM-5 came out in 2013, they started adding some in like the paragraph descriptions. They
Hmm.
started adding back some of those more vulnerable aspects. They also include a alternative diagnostic criteria, because like NPD was almost taken out of the DSM when they published the DSM-5, because it's increasingly recognized to be a unipolar description of a complex disorder, right? And so they were like, well, I don't even know if this, you know, um, diagnosis is any good, right? So what they did was they got together like a task force to put together alternative diagnostic criteria, and what they produced is actually pretty solid, and that's also in the DSM-5. But everybody still looks at the main diagnostic criteria, right? You have to like know that the alternative criteria are there and then look them up to find them. And then when the text revision came out a couple of years ago, or I don't know, the pandemic has me screwed up. It's might have
Yeah.
been as many as like 4 or 5 years ago. I don't,
Hmm.
um, like 2018 still feels like last year in some way,
Yes, yes, yes.
um, but anyway, when the text revision came out, I think it was in 22. Um, they added some stuff into the diagnostic description about suicidality, which is
Hmm.
significantly correlated with NPD. And people don't
Hmm.
realize that, they think NPD, oh, this is just some arrogant,
Hmm.
swaggering monster. And they don't realize that, no, there's a significant proportion of people with NPD who are suicidal, who have substance abuse issues because they can't tolerate being who they are. They can't tolerate what they're feeling on the inside. And it's significantly correlated with depression and other issues. So this is in fact a mental illness. This isn't just, as one person on YouTube calls it, the asshole disorder, right?
Hmm.
Sometimes
Hmm.
it's the asshole disorder, but it that
Hmm.
assholery is the tip of an iceberg that includes
Yes,
substantial mental illness.
yes, very much so. Thank you for that.
Yeah.
You do psychoanalytic therapy, correct?
Yeah.
Can you describe that a little bit, what it is, and then how it can help someone with narcissistic personality disorder?
Yeah. Um, well, so there are lots of different kinds of psychoanalytic therapy. It's come a long way since that sort of stereotype of like Freud and the patient lying on a couch, and that whole thing. Um, Although some analysts still practice with a couch. I don't. I do
Mm-hmm.
face-to-face therapy. I do therapy, 1 to 2 times a week with people, whereas a sort of a proper analyst would do therapy, 3 to 5 times a week with people. So it's a much more intensive process. And there are different sort of branches on the psychoanalytic tree. So the main one that I use three. The main one would be something called self-psychology, which was originated specifically to treat narcissism. And so that's
Mm.
sort of my primary, lens that I use. There's something else that predates self-psychology called object relations. So the explanation that I gave earlier about what splitting is, that's taken from object relations.
Okay.
And then all of them kind of come together now in what's called the contemporary relational school, which is just kind of like everybody kind of woke up around the late 1980s and 90s to the fact that all of these different branches on the tree kept pointing to this fundamental reality that human psychology is relational, that
Mhm.
my self-concept is built out of my relationship experiences, and in particular my early relationship experiences. And so the parts of me that I've sort of discovered, and then I say, oh, well, that's, you think about who you are, and oh, okay, there's a feeling of me-ness there, right? Well, that feeling of me-ness only exists in contradistinction to, a construct of what other people are, right? And
Yes.
so that fundamental sort of these are mutually dependent, co-originating ideas, me and other, right? Self and other. Um, and so even if I'm just sitting alone in a room, my psychology is still fundamentally relational because of that. And now if we include actual other people, now my psychology is super duper relational, right? And so is yours. And together, when we meet in a room to do therapy, we are creating a novel relational experience. And just as the self is originally built out of those relational experiences, the idea is that the self can be healed via relational experiences. And so that's kind of my primary paradigm when I'm doing psychotherapy. And how it actually
Mm.
looks is trying to kind of provide the right environment so that that kind of self-actualizing potential, I guess I should say some of my perspective is humanistic as well. Some of
Mhm.
that self-actualizing potential can manifest in the treatment in the form of growth and the development of new capacities that the person wasn't able to develop because of relational trauma and other factors in their life. But here now, we can sort of create an environment where we can look together at what's going on in a spirit of curiosity, patience, unconditional positive regard, and most importantly, one where there's empathic attunement to what's going on inside the patient. And that's how we become a self, right? Is by sort of,
Mhm.
there's this great quote by Donald Winnicott, who's a psychoanalyst.
Mhm.
Um, he's dead now, but way back when, he was a psychoanalyst. He worked primarily with children, and he said I'm going to butcher this quote, but something like, that the baby gazes into its mother's eyes and finds itself reflected therein, right? So there's
Mhm.
this idea that we don't have a self, and until we kind of see
Mm.
who we are reflected back to us. And that's the kind of mechanism of action, so to speak, in the therapy with narcissistic patients, is that they're seeking gratification, right? Like, tell me I'm good, tell me I'm whole, tell me I'm whatever. And I'm taking that in and not gratifying it, but instead validating it. So basically saying, I'm not saying, oh yeah, no, you're great, right? It's more like, I hear in what you're saying, like you really want to hear me say you're great. There's a way that hearing that, there's a fantasy that hearing that would give you something that you otherwise maybe don't have inside of yourself, right? So
Mhm.
that kind of um, interaction, over many sessions, can begin to engender the development of that self-observing capacity in the patient.
Sounds like this gets to the root of the issue.
I try to, yeah. That's the goal.
Mhm.
There's a lot of, I mean, yeah, as there's,
Mhm.
in therapy, there's a lot of dancing around, trying this door. Now that one's locked. Okay. Try this
Yes.
door. Up. That one opened an inch, but then it got slammed shut, and you do that over and over and over. And eventually you kind of make your way into the heart of
Mhm.
things.
Mhm. I'm curious about the introjects that a narcissist have, because we all have introjects, but I'm
Yeah.
wondering if a narcissist introjects in their mind are different than most people's. introjects. I think most people have like a memory that a parent or a sibling or a friend said something to them,
Mhm.
right? But I'm wondering if this is like a different thought process or experience in a narcissist.
Well, I think that anyone, so okay, so I'm assuming we're talking about like NPD, like a personality
Yes,
disorder right now, right? So,
yes.
and just to, the reason I'm clarifying that for your audience is because we all have like narcissist, I'm sorry, we all have personality styles, right?
Yes.
And you know, a person can have a narcissistic personality style but be relatively well integrated and
Mhm.
relatively high functioning, right? And not be engaging on a regular basis in these more maladaptive ways of coping. But their personality can still be kind of oriented around the issue of self-worth and self-esteem, right?
Mhm.
So but when a so okay, so we might say that person has a healthy personality organization or a neurotic personality organization, which just means that they're basically high functioning, right? um it's We start talking about personality disorders when a person gets into what's called the borderline level of personality organization, which is different than borderline personality disorder. So this
Mhm.
terminology is confusing, right? um but you know, if you're thinking about building a sense of self, right, over, you know, the course of development, you know, the infant's first task is to sort of tolerate that reality is reality and that it doesn't always conform to what the infant wants reality to be, right? And so that would be called the psychotic level of personality organization, where you're just that, you know, you're just trying to deal with the fact that like reality is reality and you can't magically change reality, right? So once you kind of pass through that developmental task, now the task becomes to separate self from other, right? So it's thought that early in development, there is no distinct self and there is no distinct other, right? It's just experience is just happening. And it's only over time that we begin to kind of conceptualize and separate experience into those categories of me versus you, right? Okay, so the reason I'm saying this is because anybody with a personality disorder is going to be at the borderline level of personality organization, okay, where that self and other, where they're still
Yes.
kind of fused together, or below. So, you know, sometimes they might deal with psychotic experience or just dealing with reality, but most of the time, the issues are going to be, you know, in around that kind of interpersonal issue, right? Which is why, and especially for cluster B personality disorders, which tend to hang right around that kind of borderline level. So, okay, so an introject is when you take a part of somebody else and make it a part of you, right? Uh, for somebody whose sense of self and other is well differentiated and they're well individuated, you know, maybe you're going to have like a feel like a memory of like mom or dad or an important caregiver, and that's going to feel like their presence in a way kind of in you, but you recognize that it's not you, right? For
Yes.
somebody in the borderline level, those are going to be fused together and confusing, right? And so a part of mom feels like self, or it feels, you know, so that confusion can be really distressing, especially if those interjects are harsh or punishing or punitive or have exacting demands about, you know, being perfect or being beautiful or whatever it is, right? Or not feeling, not, don't cry, you know, like whatever that is.
Yes.
For somebody at the borderline level, that those are going to be like enmeshed with self. And so the interjects tend to be we would call them more primitive, but that just means they're less differentiated. They're less over here and they're more like everywhere, right?
Thanks
Um,
for that. So I
yeah.
can see where that would lead to then. the need to develop this false self because there's this constant barrage of negative thoughts, feelings, impressions.
Yeah. It's sort of like, there's this sense, it's never thought, the child never thinks this necessarily, but it's
Mm,
felt, right?
mm,
That in order to be attached to my caregiver, I can't have these things that my caregiver won't tolerate, right? So it depends on what those things are. Sort of the classic example would be like, the stage parent, who's like pushing their kid to perform, be in pageants, be in commercials, be in whatever it is, and it's the parent's need to be famous, right? Or to have the limelight that they're then projecting onto their child and then pushing the child, right? And the child gets this very clear message that the only way I'm loved is if I am this thing that mom or dad or whoever needs me to be. And so because they're still dominated by splitting, they then are splitting off those parts of the self that are unacceptable, and they're identifying with the caregiver's need because of the introject that you're talking about, and they're working to just become this being that will be worthy of love, right? And maintain the attachment with the caregiver that they need. And then when they become an adult, they're like, I don't know why I cry myself to sleep every night or whatever it might be, right? And there's
mhm.
not a realization that all of these authentic needs and experiences were driven underground and cut off, and sometimes their whole sense of self is based on what other people seem to want them to be, and that inauthenticity is extraordinarily painful if the person allows themselves to see it.
Just listening to that makes me feel sad. So I can imagine how difficult this is to live with.
I
You
think,
can't escape it.
yeah. I mean, I was in like a consulting group, and we were talking about a colleague's patient who was narcissistic. We realized as we were talking about this patient, and that I don't remember who said it, but it was sort of like, the real pain here, like the real tragedy here, is that this person needs to, in order to develop and grow, they need to wake up to and grieve a life not lived, right? That some part of them that needed to be supported and seen and fostered was instead sort of murdered, you know and they need to grieve that loss, and it's by grieving the loss that they kind of resurrect that authenticity, right? But that grieving is so painful and so frightening, and the loss of the false self can be so like can feel so threatening that people just stay stuck. um
Mhm.
and that's true for lots of issues that people
Most
have,
people do.
right? Like not necessarily about authentic self versus false self, but you know any therapist would often encounters this thing where the patient, in order to grow, they need to uh, let a reality in, or a realization in that feels terrifying to them.
So because the person with NPD is in their younger years performing for the parents,
Yeah.
they carry this with them into their adulthood. And is this where then they develop sometimes this shared fantasy where they feel like they have to be what their partner wants them to be? And so they present to their intimate partner as if they're one person,
Mhm.
when in reality, there's someone else.
Yeah, and it's often mistaken for manipulation, right? Like conscious manipulation. Like, this person was lying to me the whole time. Well, yes, but they were also lying to themselves, and they felt and probably continue to feel like the only version of a person they can be is this version that they continually are presenting to the world. And I'm sorry, I forgot.
We're just talking about this shared
Yeah,
fantasy and how
yeah,
you were saying that oftentimes the intimate partner,
uh-huh.
feels as
Right,
though the
yeah.
narcissist consciously manipulated them.
Yeah, but there was something else in what you were just saying that I thought was really important, and I lost the thread.
I said that earlier when the person with NPD is a child, they have to perform.
Yeah,
And so do they then perform for their intimate partner
yeah.
thinking, I have to be what you want me to be to
Yes,
get you to like me?
yes, yeah. Oh, I know what it was. Yes, and thank you. So the partner ends up feeling manipulated and sort of duped, but
Mhm.
the narcissistic person will end up feeling resentful, right? Because on the inside, they're constantly having this feeling of not being loved or seen or cared about for who they are. But the disconnect is that they don't realize that what they're experiencing on the inside isn't making it to the outside. So a lot of times, like some of the first interventions that I do with people is just talking with them about, okay, so what do you think your partner actually sees, right? Like you're telling me that, you feel, you know, bad or sad, or you felt like you needed some help with, the feelings you were having. But do you think they could see that? Do you think that was ever communicated? Or did you kind of put out this sense of like, I'm fine over here, thank you. And on the inside, you're falling apart. And then you somehow hold them accountable for not being able to know about that internal experience that you never communicated. And oftentimes I think that's happening, and that's where that resentment will build and build and build until they finally snap, and then there's a kind of a narcissistic rage that happens.
Mhm.
And it's fueled by this kind of righteous anger, right? Like you never see me, you never, whatever it is. But the way it comes out again is very blaming and externalizing, because the narcissistic person can't tolerate the shame that's attached to saying, I'm scared, I need you, I feel disappointed. They can't, saying that exposes them to a kind of toxic shame they just can't tolerate. And so that vulnerable feeling becomes this kind of arrogant, condescending thing instead. And they're not even aware that that's happening until it's sort of pointed out, sometimes over and over and over again. And then they can gradually start to kind of track what's happening there.
So when the intimate partner kind of brings reality to the person with NPD and says to them, here's what happened. And the person with NPD keeps denying it.
Mm-hmm.
And they're even shown proof and they keep denying that. Is that because they just cannot reconcile their false self with, they don't have a true self? So I don't know what to refer to the other.
Well, so there is, I think there is I think false and true is the terminology.
Splitting.
Yeah, it's like there's an authentic experience, but it is actively, unconsciously denied. So here's a good example. So I just made a video for my channel about attachment, right? Sort of
Mhm.
talking about narcissism uh, through the lens of attachment. Children who are so in narcissism, there tends to be a strong or a high amount of attachment avoidance, which is sort of like not getting close to people. Like when you're upset, I would assume you get close to people because that helps you feel better. And that's kind of like the normal way to do it, right? When we're distressed, we seek support. But for somebody with high levels of attachment avoidance, when they're distressed, they don't tend to seek support. And what they tend to do
Mhm.
instead is turn the volume down on their distress. And you
Mhm.
can see that in very small children. when they're doing like attachment studies, these children, when they're upset, they don't appear upset. Instead, they focus in on a toy or they distract themselves somehow. But if you measure their heart rate and other physiological signs of distress, you can see that they're actually upset. But they're learning to turn the volume down on their attachment system so that they don't communicate, they don't feel that distress and they don't communicate that distress. And so that right there, I feel like, is a great in vivo example of how that splitting develops, right?
Mhm.
The conscious experience is I'm fine, I'm just playing with my toy. And the physiological experience is I'm freaking out, right?
Mhm.
And then over time and years and years and years of that getting reinforced and reinforced and reinforced, it can turn into I'm just fine, right? But I'm like, you know, uh, having cortisol release, but I don't even consciously register that that's happening, right? It just shows up in the form of whatever, like however those unconscious things we all push down show up, you know. So I think that's kind of where the authenticity goes. Um, yeah,
Thanks for that, because I think that's really, really hard for people on the receiving end
yeah,
of hurtful behavior from someone with NPD to understand. The other thing that's curious to me is it seems as though people with NPD, this is rooted truly in abuse or neglect, or intermittent, you're wonderful, abuse and neglect. You're wonderful, abuse and neglect. So there's
mhm,
this mixed message. That same parental type of behavior can also create a person who's very, very sensitive and empathic to others.
mhm,
And it's curious to me how this same parenting style can create in the same family two different,
yeah,
almost seeming like polar opposites, although they have a lot of similarities. um, and I know that there's been some studies where researchers have done MRI of the brain
mm,
on people with NPD. And these particular researchers are saying that there's some type of a brain dysfunction in people with NPD. What does the research say, and what's your opinion about is NPD just this parenting style and environment, or is there something else going on?
well, I think, yeah, I think there's always, you know, something else going on, right? I mean, there's like we're all born with a certain, you know, a genetic, kind of a genetically determined temperament, you know, just a basic temperament. Like, are we easy to soothe or difficult to soothe? Are we really sensitive to the environment or kind of not so much, you know? And all these different kind of ways that just our bodies just kind of respond, you know, or maintain homeostasis. And since we kind of emerge, you know, our psychology kind of emerges out of that kind of, you know, that experience of being embodied and being kind of assaulted by experience, right? You think of like an infant just lying on the table, just, you know, I mean, they're just, um, it's all about, you know, distress and the feeling of hunger and what's that, and you know, and aloneness and what's that, and I'm cold all of a sudden and what's this hard surface I'm on, versus kind of being held, being warm, being looked at, being met, you know, by somebody's gaze, being fed, all those, like just that basic kind of, you know, self not self kind of experience, right? So an analyst called named Thomas Ogden calls this the autistic contiguous mode of experiencing. And the autistic in this sense just means not self, you know, kind of like being like a coming up against things that are not self, that kind of make you prematurely aware of existing in a body that's vulnerable in some way, versus contiguous, which is being kind of merged, held, kind of experiences of the boundaries of self kind of being met by something similar versus the boundaries of self being met by something that's cold, angular, not, very much not self, right? Anyway, getting too deep into this. But what was the question? Sorry. Oh, about MRI studies, yeah, and
Yes.
about kind of the nature nurture debate.
Yes.
Yeah, so I think there's always kind of a genetic component, right? And twin studies and studies looking at heritability of NPD, they vary. One study I saw said it's about 25%. I've seen it as high as 50%. So like just it varies. It's hard to say for sure. And I think it's also important to remember that no two children are raised in the same family, right? So, the birth order matters. What's going on during the first couple of years of life matters. Maybe the mom,
Mhm.
had postpartum depression after the first child, but then,
Mhm.
was receiving treatment and didn't have it so much after the second child. Or, maybe the first
Mhm.
child was born and the second one came right on the heels of the first one, or maybe there's a 5-year difference and things changed in the family, or maybe there was a death or an illness or financial trouble or whatever it was, right? And even if those conditions are relatively, stable, there's still, the ways that each family member contributes to the family system and kind of derives a role in the family system as a result, right? So,
Yes.
and especially in a family system where there's a lot of dysfunction or there's the kind of things that are happening that tend to contribute to the development of personality disorders like NPD, right? So those kind of family systems tend to really promote kind of like uh, role-based, you know, experiences, right? So there's the black sheep and there's the hero, and then there's the invisible
Mhm.
child, and all that kind of family system stuff. Um, so I think that can play a huge role in how those wounds are kind of incorporated into a personality style. Um, so I think it makes sense that, sometimes there's one person who's just symptomatic, right?
Mhm.
And we would in family therapy, we call that the identified patient. Little Johnny is having trouble at school, and the parents are like, I don't know what's wrong with this kid, fix him, right?
Right.
But the therapist sees that little Johnny is manifesting symptomatically the family's dysfunction, right?
Yes.
But meanwhile, little Sally over here, she stays quiet. She's learned that if she doesn't rock the boat, she doesn't get in trouble, right? And so, she's quietly internalizing all of the family's issues while Johnny is externalizing, right? And you might end up with something like sort of a, you know, an empath kind of configuration in Sally versus maybe a NPD kind of configuration in Johnny. Just it's hopelessly
Excellent
complicated,
points.
right? Yeah.
It is. It really is. And, I'm finding that NPD is one of the most complicated diagnosis that exists. And I want people watching this, I think, to understand that I'm not sure what the reason is. You might have more insight into this, but I think that a lot of therapists don't understand NPD because we're not taught about it.
Yeah.
As we said earlier, the DSM doesn't really describe it in its fullness. Um, and I'm not sure why our educational systems are failing us in this way. Um,
Yeah,
I don't know if you have
it's
insight into that.
I mean, I don't know that I'd have any more insight than you about it, like it's just kind of, and I've heard this from other people as well. I'll tell you one thing, I'll tell you two things. So the first thing is that I remember being in training, and when you're in training, you're in like these case consultation groups a lot, and you're talking about cases with a supervisor there and that kind of thing. So anyway, a colleague was talking about a patient that they had, and I said, well, that patient sounds narcissistic, right? And the colleague was like, yep, and then kept on going, right? And they were like, I don't understand what's happening in this treatment. I don't understand the patient. And I was like, well, they sound narcissistic. Yeah, okay. Kept going. I said it 3 or 4 times. And finally, the colleague was like, yeah, I get it. He's a narcissist, but how does that help me? Right. And I realized that to this person, I was just essentially calling their patient a name, right? I might as well have
Mhm.
said that your patient sounds like a jerk or your patient sounds selfish,
Mhm.
right? They didn't, they weren't aware that saying that somebody is narcissistic is saying something about how that person is put together, what they need, how the therapy relationship will progress, and also saying something about what kinds of interventions they might try.
Absolutely.
So that's the first thing, right? And so that was in training. Um, and The other thing is that so I'm a professor at a in a doctoral program where people are becoming psychologists. And one of the things that we talk about as a faculty is how can we increase um, our students' ability to, think in complex and nuanced ways about clinical work. There's a tendency, and I think that this goes all the way up to, the APA and what the APA is kind of asking for, in terms of a curriculum in order to accredit a doctoral program. Um, there's this emphasis on intervention, right? Like what do you're going to use this intervention for this issue, that intervention for that issue, right? And it's kind of like this medicalized sort of paradigm. But what the students aren't getting is like how to think about and understand um, a, a patient's presentation. Why do you use this intervention? Why would this intervention work better than that one? And even more specifically, how to think about what's going on between therapist and patient, right? So the
Mhm.
same intervention deployed in 2 different therapies can have dramatically different results. And that really depends on what's going on between the therapist and the patient. So
Mhm.
um, I guess all of this is just to say that I think there is this emphasis on, what are the symptoms, what's the diagnosis, what's the intervention, and not
Yes.
really like how do you see this patient, how do you think about this person and their life, how do they make you feel, right? And how can you use that information to understand how they feel and how other people in their lives feel, and how can the two of you make meaning together, right? Such that you can affect like real change. Um, there's a one psychologist, or he might be a psychiatrist, Jonathan Shedler, is a big advocate against what he calls manualized therapies, or that he feels that clinicians are becoming technicians essentially,
Mhm.
that they just they're met with like a symptom presentation, they've got like an algorithm, they deploy a treatment, but are never really thinking in that process. And that's something that used to be heavily emphasized in clinical training, and now it's really kind of sidelined.
Yes. And therapy is an art form
Yeah.
in addition to, having knowledge and understanding mental health and all, psychology and all these different things. Dr. Eatonson, kind of what's your takeaway that you would like people to really walk away from watching this, understanding, knowing, thinking about as
Mhm.
they move forward with NPD?
Well, okay, I guess one thing is that you can't, like, if you're just if you're a layperson, right? You can't ever change. Well, none of us can change anybody, right? Not me
Correct.
as a therapist, not somebody as a spouse or a son or a daughter or a parent. None of us can change anybody. Um, it is possible to treat NPD, and it's possible to treat it effectively. It's possible to see somebody go from personality disordered to no longer meeting any criteria for a personality disorder, whether it's the DSM or it's an alternative model. Um, that happens. But that isn't because I have some kind of magic intervention, you know, like toolbox over here. It's because primarily the person is invested in the work. And yes, that does happen in NPD. It might seem rare, but it does happen. And I actually have a wait list for services. Like, and I'm like trying to figure out what to do. Like, how can I more effectively treat all of the people who seem to want or need treatment for these issues? But that's not something that, you can't like read a book or watch a video or whatever, and then like go home and, like turn your spouse, from somebody with NPD into somebody without NPD, you know? Um, that's one of the big takeaways I would say. I guess
And
another take, yeah, go ahead. Yeah.
go ahead.
Oh, I guess another takeaway I would say is that we're all people, you know. I see all kinds of wacky stuff in the comment section of my videos, people who are just really, really like in that kind of split mindset, and the narcissist is the devil, and, they're evil, and, you know, etc. And I also see, ideas that like it represents some kind of like divergent evolutionary path, that like narcissists are like a new like subspecies of human.
I haven't seen that. That's
Essentially, yeah.
wild.
I never conceived of it until I started my channel, and then I started to see things like this. So there's all kinds of ideas out there about NPD. It's sort of the diagnostic label to, shit on. I mean, it's just
Yep.
it's so easy to do, right? But that is because of the kind of tragic nature of the false self-defense that narcissists have. And so they hide what they need and how they really feel, even from themselves, right? Instead, they put out this kind of self-sufficient, grandiose image. And so, so nobody sees the person behind this, right? Which is just a continuation of the trauma that caused that, you know, personality disorder to develop in the first place. Um, Now, I don't think that somebody who's like in an abusive relationship should, like uh, endeavor to, just provide empathy to somebody who's hurting them. I think that's a bad idea. But I do
Mhm.
think that as a society, we could stand to extend some more empathy and compassion in the direction of this particular disorder, because there are just two poles of around which personality develops, right? There's the
Mhm.
pole of self, and there's the pole of others. All of us have this fundamental polarity in our personality structure. And since narcissism is sort of the clinical term for an issue having to do with the pole of self, pathological narcissism is much more widespread than people care to think. It shows up in all kinds of disorders. It shows up in major depressive disorder, for instance, right? Feelings of
Mhm.
worthlessness, feelings of shame, it shows up in other disorders that people sort of tend to look at as kind of harmless, right? There can still be a significant component of pathological narcissism there. That doesn't mean they have NPD. That means there's something going wrong with their relationship with themselves. And so, I feel like the issue is much more nuanced and complicated than, you would think if you're just scrolling Facebook or TikTok, or you're watching, videos online. I would tell people, stay away from the reactive channels, the ones that have the titles of like, 8 ways to like counter abuse the narcissist or whatever, right? I mean, all of that, that's all garbage.
Demon.
Yeah,
Demon.
yeah.
Yeah.
I'm sorry to say it's garbage. And it might feel good because you're angry or you're hurt, and it's okay to be angry and it's okay to be hurt, and we all need to move through a space where that feeling dominates things, but that's not the end of the process. The In all forms of psychological healing and recovery, the end of the process is something more like acceptance and forgiveness, and being able to see the humanity, um, in everyone involved, even the people that hurt you. Doesn't mean letting them continue to hurt you, right?
Yes.
Boundaries are a
Mhm.
thing.
Mhm.
But it does mean that in order for you to heal, you need to, at some point, let go of the rage and begin to see the full picture. Uh,
Very good.
yeah.
So Dr. Mark Ettensohn, as we have heard, treats clients with narcissistic personality disorder. I'm Lisa Taylor Austin. I treat intimate partners of people who have been involved with narcissists. I want to thank you so much for your time, Dr. Ettensohn. And a quick disclaimer, the comments that we made here today are our own and they're not indicative of the professions that we're in as a whole. I'd like to have you back in the future to discuss this a little bit more. I appreciate your time so very much.
Oh, well, thank you for having me, and I appreciate your time and your questions. And this has been great. So I'd be happy to come back on anytime. Thank you.
Great. Thank you and take care.
You too.